Hi, Dr. Connie here. So last week I talked about the importance of balancing trace mineral imbalances of copper and zinc to reduce behavioral symptoms and limiting the use of mind-altering medications, considering them only as the last resort solution. Today, I want to talk to you about another nutrient that should be considered by all healthcare providers, parents, and those struggling with ADHD, and that's magnesium. So magnesium is a macro mineral that is required for hundreds of biochemical reactions in the body, including protein synthesis, muscle nerve function, blood glucose control, bone development, DNA synthesis, and glutathione synthesis. Glutathione is a super antioxidant in our body. So let's talk about magnesium and brain health. So the bioavailability of magnesium affects the function and the binding of neurotransmitters to their receptors. These neurotransmitters include serotonin, dopamine, or serotonin and dopamine, also known as our feel-good hormones. For example, magnesium can improve the transmission signals of neurons by serotonin receptors. Magnesium also keeps the excitatory neurotransmitter glutamate within the optimal limits by inhibiting certain receptors. So magnesium also supports your calmness by supporting GABA and its interaction with its receptors. Magnesium deficiency is a modern-day problem. So over the last century, magnesium levels have been decreasing due to our food supply, and this is because of processed foods, modern fertilizers, and soil depletion. So refining grains removes up to 80% of magnesium, and consuming refined foods such as soft drinks and caffeine also depletes magnesium. So approximately 50% of Americans of all ages have an inadequate intake of magnesium according to the research. Some symptoms of magnesium deficiency include irritability, difficulty with concentration, insomnia, depression, and anxiety. An astounding 95% of children with ADHD are also deficient in magnesium. In fact, all children can benefit from magnesium supplementation. Among the children ages 6 to 16, 72% were found to be deficient in magnesium, and a high correlation was noted between hair magnesium, total IQ, and hyperactivity. In a study involving the children who were deficient in magnesium were given 200 milligrams of magnesium supplementation plus standard medical treatment. And it was found that those taking magnesium experienced significant improvement in hyperactivity, impulsivity, and conceptual levels compared to those who took medications alone. So let's talk about magnesium supplementation and how it improves ADHD symptoms. So evidence indicates magnesium taken with vitamin B6, which increases magnesium absorption, improves physical aggression, instability, attention at school, muscle rigidity, spasms, and twitching. Researchers concluded that chronic magnesium deficiency is also associated with hyperactivity, irritability, sleep disturbances, and poor attention at school. Various studies evaluated children with ADHD who supplemented with magnesium vitamin B6 and resulted in improved anxiety, attention, and hyperactivity. So magnesium improved attention, work productivity, task performance, and decreased careless errors. More objective findings with the EEGs proved positive benefits by demonstrating the normalization of brain waves with magnesium B6 supplementation. So what do you do to eat, or what do you eat to raise your levels of magnesium? Well, encourage your ADHD kids to eat bananas, avocados, beans, and green leafy vegetables. A population-based cohort of over 600 kids with yearly follow-ups from ages 14 to 17 found that higher dietary intake of magnesium was significantly associated with reduced attention issues, delinquent behavior, and aggressiveness. It's important to mention that only 30 to 40% of dietary magnesium is absorbed by the body, so supplementation is the most reliable way to increase magnesium levels in children and adults with ADHD. So how do you measure magnesium levels? Well, it's often difficult to assess magnesium levels because magnesium is stored mostly inside the cells and the bones. Therefore, serum levels are not a good reflection of magnesium status. So tests are usually inaccurate and often unnecessary because most patients with ADHD can benefit from supplementation. And when it comes to magnesium, clinical symptoms such as constipation, anxiety, insomnia, and irritability are often a better assessment of deficiencies compared to lab testing. So let's talk a little bit about magnesium supplements. There are several forms of magnesium supplementation: magnesium glycinate, magnesium oxide, magnesium citrate, and magnesium gluconate. I recommend magnesium glycinate for supplementation and magnesium citrate for constipation. Remember, it's important to get sufficient magnesium to effectively support our neurotransmitter systems. And studies consistently show ADHD children who are nutrient deficient overall suffer from more severe symptoms. This is a problem because kids who have ADHD tend to be picky eaters, like my own. It's a good idea to supplement your child with a broad multivitamin mineral supplementation to ensure that they're getting all that they need for optimal growth and development. So in conclusion, as I mentioned in the prior blog, reversing copper-zinc imbalances and addressing magnesium deficiencies can yield significant restrictions or improvements in ADHD symptoms and improve cognitive performance. And incorporating nutrients or nutrition is key to managing and preventing ADHD and other neurological issues associated with brain health. If you need quality supplements, a consultation, and/or have further questions, please call us today. If you or anyone you know has ADHD or suspects that they do, please share this video. And as always, thanks for joining me. Subscribe, like, and share our post and our video. And see you next week.